Yeah. Hi students, this is Dr. Badrinath and we are studying a subject of pharmacology. And in this video, we will see the concept of calcium, basics of the calcium and various facts of the calcium, real facts of the calcium that we are going to be discussing in this video, right? And this is the symbol of Indian Dental Association. See, the strongest teeth is made up of calcium. That's why they have selected the animal of elephant. That is a Lord Vinayaka. This is the strongest teeth, hardest, not strongest, hardest teeth is the made up of calcium, right? Yeah, here you can see this is one of the important bit. It was appeared in number of times. It was appeared in the examination, competitive examination. Hardest bone is the teeth. Hardest. Strongest bone is the femur. You can see the femurs here, which are in a red mark. These are the femurs. Strongest bone as well as the longest bone is also femur. Both are made up of calcium only. Bones are made up of calcium. Teeth are made up of calcium. Calcium is having a tremendous importance in the body. Okay. And also if you see in a mythology, this bit is very important. Longest bone and hardest bone, strongest bone. You find the difference. Yeah, in mythology also, this is the Lord Indra. Okay, this Indra, they go to Dadichi Maharshi and they want the one weapon, which is a very hardest and which is the strongest weapon. They will ask the Dadichi, and this is a Vajrayuda. He has Vajrayuda, Indra. This Vajrayuda weapon is made up of backbone of this person. That is a Dadichi Maharshi. He has a backbone which is made up of calcium. That calcium becomes a strongest weapon in the entire universe. This is called a Vajrayuda. And with the help of that Vajrayuda, he will kill the Asura. This is a mythology as per the Hindu mythology. And this is your syllabus of the pharmacology. Yeah, in the D, you see the A, B, C, D, hormones regulating the plasma calcium level, parathormone, calcitonin, vitamin D. This is our topic. In this topic, I will concentrate only on the calcium level. Okay, in the next video, we will see the hormones which regulates the calcium level in the body. Here, only the calcium basics, calcium facts. Okay, see carbon, oxygen, hydrogen, nitrogen. Next is the calcium. Calcium is the fifth largest element in the body because all the bones, teeth are having a calcium only. It is a fifth largest element in the body is the calcium. And also here you can see the round figure fifth. Here you can keep in your mind 10, 9 to 11. Average you can take a 10. 10 you can keep in your mind. So here 5, fifth is the largest element. Here 10 mg, milligrams per deciliter, normal plasma calcium level in the plasma. That is in the blood, 10 milligrams per deciliter. That point you have 5 and another one is a 10. Those 2 points you have to keep in there. Fifth largest and 10 milligrams per deciliter. Total calcium of the body, 100%, if you consider, 99% is present in the bone only. Bones, teeth, etc. and all 99%. Only 1% is present in the remaining. That is as a ECF. Nothing but extracellular fluid, ICF, intracellular fluid. Here you can see extracellular calcium. This 1% is divided into ECF and 1% is divided into ICF, like that. See, this is the cell, intracellular calcium. We know this is a cell and inside there is a nucleus also. You can see my cursor. This is nucleus. This is a cell. That's why here I wrote intracellular calcium and this is outside of the cell. That's why I wrote here extracellular calcium. And you can see the number of jobs of the calcium. Calcium plays very, 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 very important role in the body. Without calcium, you cannot expect our body. See, what are the jobs of extracellular calcium? That is which are present outside the cells. First one, maintaining the intracellular calcium. See, the name here extracellular calcium, but it maintains the intracellular calcium. See, whenever there was no calcium in the intracellular, extracellular calcium will enter inside the cell. Like that, it maintains the intracellular calcium, bone mineralization, bones. These extracellular calcium will go and deposit in the bones. Okay, that's why it is a bone mineralization, blood coagulation. Blood coagulation, we know that there was number of factors are there. In that, one factor is the calcium. Calcium is important factor in the clotting of the blood, coagulation of the blood. Okay. Plasma membrane potential also, it is made, calcium is responsible, extracellular. And if you see the intracellular calcium having a role, muscle contraction. Whenever you want to contract the muscle, lifting of weight or doing some work, you have to contract the muscle. In such a cases, definitely calcium is regular. And also hormonal secretion from the endocrine glands. Okay, it cannot release the calcium very simply from the glands. You know that various glands are there, adrenaline glands. Hormones will be secreted, but there must be a calcium role. Without the calcium role, there is no secretion of hormones in your body. And glycogen metabolism, you can see here, glycogen, you know very well. And also cell division. Cells will be divided and cell will be grown with the help of calcium only. You know that in fact, there are various calcium channels, you know very well, in our body. Number of calcium channels are there in our body. The roles of calcium in our body, first one, see, regulating the heartbeat. Heartbeat. Without calcium, there is no heartbeats. There is no proper heartbeats. And muscle contraction. Whenever you want to do your work, that's why what we have, intracellular calcium is mainly responsible for muscle contraction. And fluid balance within the cells. Balance, extracellular, intracellular, exchange will be there, calcium. They will maintain their own balance. And also building the strongest bones and strongest teeth. And nerve impulses like repolarization, depolarization, you know very well in the pharmacology that we know the nerve signals generate, nerve impulse will be generated with the help of calcium, potassium exchange. Okay, very important role, nerve impulse. And also transmission of the signal from one neuron to another neuron. It requires the calcium. Without calcium, there is no signal between the nerves. Nerve impulse generation as well as the signal transmission also. Next is blood clotting. We saw already all these things. Yeah, this is as per your K.D. Tripathi book. They wrote calcium roles, physiological role, functional. Physiological means functional, not anatomy. Anatomy means structure. Physiology means functions. So calcium controls the, so what we saw so far in the slides, the same only here. Excitability, you can see excitability of nerves, muscles, regulates the permeability of the cell membrane. It also maintains the integrity of the cell. Underline points are very important. And also essential for excitation, contraction, and muscle and excitation, secretion, exocrine gland, endocrine glands, release of transmission of nerve ending, and also intracellular messengers, just like giving a message. And impulse generation in the heart, that what we saw already. Generation of the heartbeat, and also coagulation of the blood. Calcium serves as a structural function for bone and teeth. All these we saw so far in the diagrammatic pictorial representation we saw. This is the matter what they have given in the pharmacology book. Next we can come to the calcium absorption. How the calcium will be absorbed. If you are taking a calcium food or you are taking a calcium tablet, what happens in the intestine? The calcium tablet will release as the plenty of calcium in the intestine. That calcium will be enter into the blood. How it enters? How it transfer from the intestine to the blood? Here you can see calcium absorption, facilitated diffusion. This point is very, very important. Which type of mechanism? Calcium will be absorbed from the intestine to the blood. Facilitated diffusion. Only that point you have to keep in your mind. From the entire small intestine. You know that entire small intestine. Okay. Facilitated diffusion. Here you can see some pictorial presentation. It comes in the biopharmaceutical subject. Okay, but here you can see extracellular space, intracellular space, facilitated diffusion will be there like this. Calcium will come and sit here and it will be transported to another side. See this picture. Here it is catching. Here it is in between. Here it is releasing. See my cursor. 3 steps I have wrote. These are all called as a carrier proteins. This facilitates the diffusion of a calcium from intestine into the blood. Next is calcium absorption also happen from the duodenum, especially carrier mediated. There must be some carrier will be there, especially in the duodenum part only we are focusing. Okay, first from entire intestine, facilitated diffusion, entire intestine. If you come to the particular duodenum part, that is a D. D I have here. Vitamin D helps to the calcium to a great extent. Okay, see here, calcium along with vitamin D. Okay, so vitamin D is carrier here, carrier mediated. There must be a carriers. Okay, that carrier is nothing but vitamin D, matching so that you can easily remember from duodenum, vitamin D as a symport. Symport, you know export, you know import, but we don't know symport. Here you can see what is a symport. I will explain you. See here, symport. This is the uniport from one side to another side, only one direction. Here you can see the symport. This here one is calcium and another one is the D. Both will collectively together. It enters into the blood from intestine. That is in the duodenum, from the duodenum. Okay, that is called a symport. Antiport. Anti, name itself indicate it against. One goes, one comes. But this antiport and uniport we are not discussing here. Symport, duodenum, vitamin D, calcium. Both together, it will be symport, like a dual SIM. Okay, in your cell phone, dual SIM will be there, no? Like that SIM. SIM is important. Combo offer. That's why all the tablets are made up of, calcium tablets are made up of along with vitamin D. Why means vitamin D enhances the absorption. Which type of transport? Carrier mediated transport. That's why, see this is a very important brand, Cipcol, CIP. It is made up of Cipla. Cipla, you can see the Cipla here. Okay, Cipla, this calcium and vitamin D3 tablets. This combination is very, very powerful, very, very important. You can check with the backside of the calcium tablets. There will be a D3 vitamin will be there because it facilitates the absorption. Yeah. And calcium absorption will be decreased by the POT, POT. This is the technique how to remember. POT, phosphates, oxalates, tetracycline. This is very, very important. Tetracycline, don't take tetracycline with milk. Right? Or don't take tetracycline with coffee because coffee also consists of milk. Milk consists of again calcium. So don't take a milk with tetracycline, coffee with tetracycline. Curd also consists of a calcium. All dairy products consist of a calcium. Okay, phosphates, oxalates, tetracycline decreases the calcium absorption because it forms a insoluble complex. When the complex is insoluble, it cannot be absorbed from the intestine. It is there in the intestine itself and it will be excreted through the fecal matter. When it becomes a soluble, then only it will be absorbed. So here it forms all these forms a insoluble complex in the intestine. Okay, so no solubility, no absorption, only insoluble complex excreted in the fecal matter. Entire thing is waste. And also, these are the two drugs, PG, post-graduation, phenytoin. Okay, phenytoin. It also sounds like a pot, phenytoin. Glucocorticoids. This decreases the calcium absorption. But it may be, these things are forms an insoluble complex. But here mechanism they don't know, phenytoin and glucocorticoid decreases the calcium absorption from the intestine into the blood. Calcium excretion, thiazide diuretics decreases the calcium excretion through the kidneys by increasing the calcium reabsorption. Calcium will be reabsorbed again, so that it will not be excreted from the body if you are taking with a thiazides. thiazides, and calcium is available in 6 forms. These forms are very important. How you are taking a calcium, which form you are taking. Okay, so totally you can see 6 forms are there: calcium carbonate, calcium chloride. These forms are very important in the examination, especially in the competitive examination. Calcium carbonate, calcium chloride, calcium dibasic phosphate, calcium citrate, calcium lactate, calcium gluconate. All these forms are there in the pharmacology Tripathi book. Okay. So here you can see the calcium percentage: 40%, 27%, 23%, 21%, 13%, 19%. In the decreasing order I have given. Okay, all these you have to keep in your mind and keep it. This highest one is calcium carbonate, lowest one is calcium gluconate. The two along with percentage you have to remember. Okay, all these names you can be by heart, and first and last one percentage also you try to keep in your mind. Calcium carbonate, here you can see the calcium carbonate. Okay, it is available in the form of capsule. You are taking it orally. Calcium carbonate, first one, highest content of the CC, carbonate, carbon. That is first element in our body is a carbon only, C. So calcium carbonate, like that you can remember. Okay. Next is calcium chloride. It is available in the injection form. In the exam they will ask which form it is available in the injection form. Calcium chloride as well as a calcium gluconate. See here, calcium chloride injection is there as per the USP. Next is calcium dibasic phosphate. You can see the calcium dibasic phosphate, especially animal feed for the strengthening of the bones of the animals. Which form is important? Calcium phosphate, dibasic phosphate. Next is calcium citrate is available in the form of a tablets. Orally you can be take. Calcium citrate, vitamin C will be there because citrate we are using, no? It is also a very good one. Next, calcium lactate is available in the form of tablets. Only 2 are the injection. Keep in your mind. Okay. Calcium lactate. Lactate means milk. Milk consists of calcium. Like that you can remember. Calcium lactate. Milk tablet. Like that you can remember. Milk calcium, milk tablets. Calcium gluconate. This is the injection. See here. 1 gram per 10 ml. 100 mg per 10 ml. That is a per ml. Like that they will give in the 2 ratios. Okay. Yeah. These are the sources, important sources of the calcium that you know very well. All dairy products, milk, especially milk, curd, consists of the calcium, and various juices names are there. Okay. That you can take a screenshot. And calcium side effects. First one is the constipation. Motion will not be there. That is the main problem of the calcium. If you are taking in excess, and also bloating, this is also one of the, your stomach will be like this. It becomes because of the gas. Bloating is whenever belly feels swollen after eating. So whenever you are taking a food, you will become belly comes, little bit belly comes because of the excess calcium. That is called as a bloating. Okay. And also excess gas. You can see here, you can see this is the stomach. Excess gas will be especially with the calcium carbonate. That is very, very important point. Which form of the calcium gives the side effects of the excess gas? Calcium carbonate. Carbon dioxide gas, like that, carbon, you can be matched and keep in your mind. And calcium mainly using for the treatment of tetany. See, crossing of the bones. Bones will be grow into cross. Okay, especially in the old age people, because of the less calcium. Hands will be like this. This is called a tetany. For immediate treatment of the severe cases, you just give a calcium gluconate injection. That we saw calcium gluconate form so far. Elemental calcium 92 is injected IV directly into the venous over a 10 minutes of the period. And calcium as a dietary supplement, like a children's, especially women's. See here, calcium. Women's need a plenty of calcium. That's why Horlicks is making a separately for the women's Horlicks. You can see here. women's Horlicks, especially for the calcium, especially from the age of 30. Okay, from 30 compulsory you have to take. If it is possible, you take from 20 itself. So this is a film actor Tapsi is recommending, and these are the National Institute of Health recommending all these children's 1 to 10 year how much mg daily they have to take. Women 1.5. See, highest is the women they recommended. Women is a 1.5 gram that you have to keep in your mind. 1.5 gram daily requirement. And osteoporosis, this is a third usage. This is dietary supplement. First one is tetany, dietary supplement, and osteoporosis. Your bones will become like this. This is a light osteoporosis. It becomes a pores. That's why it is called a porosis. Here also you can see pores. This is a severe condition. This cursor, see my cursor. This is a light condition. This is a severe condition. In such a case, what you have to do, all these matter from pharmacology Tripathi book only. Calcium plus vitamin D3 combination has to adjuvant role in the drugs, preventing the osteoporosis. Okay, so I stopped here. In the next video, we will see what are the various hormones that going to balance the calcium level in our body. Hormones plays a major role in the control of the calcium level in our body. Okay. Yeah, thank you. In my playlist, I have kept all my videos that you can watch.